Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Our research topic today highlights the November 2016 revised medical recommendations for the common arthritic-like condition known as fibromyalgia. Now, fibromyalgia is one of the most challenging and frustrating conditions for doctors to treat. It affects 2% of the population, which would include 5 million Americans and about 1.5 million Canadians. So the condition affects more women than men by a ratio of about 7 to 1. And most of these cases are diagnosed during middle age. Now, as you probably know, patients with fibromyalgia have generalized pain, fatigue, and the sensation of feeling unrefreshed upon awakening. They often experience migraine-type headaches, shooting pains in their extremities, and have increased sensitivity to light touch. And they also often complain of intestinal symptoms such as diarrhea and constipation as well. So fibromyalgia is not a disease per se, but rather a constellation of clinical symptoms. Now, in 2007, the European League Against Rheumatism published recommendations for the treatment of fibromyalgia. But in 2016, in the Annals of Rheumatic Diseases, a group of 18 rheumatologists, other health professionals, and patients from 12 European countries published revised recommendations for the treatment of this condition based upon an extensive literature review and the meta-analysis of all the available data. Their findings confirmed the fact that pain-killing drugs like tramadol, as well as anti-inflammatory drugs, narcotic drugs, and antidepressant drugs are not effective treatments in most cases of fibromyalgia. The most important conclusion that came out of these revised recommendations was that, based upon very strong evidence, both aerobic exercise and strength training exercises are the most effective methods to treat fibromyalgia. Researchers stated that they now have very strong evidence from the literature that suggests that a supervised exercise program for aerobic conditioning and strength training is the basis for the treatment of this symptom complex. I will tell you that from my own clinical experience, I often took fibromyalgia patients onto the gym floor myself and showed them exactly how to do a strength training exercise routine to reprogram their muscles and break up stubborn adhesions and fibrotic nodules within their muscles and connective tissues. And I saw over the years how extremely helpful that method of treatment was to their overall success in managing the condition. Now, in addition to a basic strength training program, the aerobic exercise portion helps to improve not only endurance strength, but it calms the central nervous system, which in turn improves sleep quality and often improves the intestinal symptoms like diarrhea and constipation. So I'm really pleased that these findings were presented to rheumatologists at the American College of Rheumatology 2016 annual meeting in November of 2016. I hope it'll prompt more physicians to prescribe exercise as the foundational treatment for these conditions, as it's been shown to be the most effective treatment for fibromyalgia patients. And by the way, researchers of the study also noted that other natural therapies such as acupuncture, Tai Chi, and meditation were also very helpful adjunctive measures to include in addition to exercise. So I've included a link to the studies and the Medscape review article in the text below for your consideration. If you have fibromyalgia, or you know someone who does, then I think you'll find the studies and recommendations to be of great value. So thanks for watching, and I'll see you next time.